as of the time of this recording, there are 6 FDA approved botulinum toxins. That's Botox, Dysport, Xeomin, Jeuveau, Daxxify, Lativo. So I've used all of these toxins, and I keep going back to the Dysport because as of now, I find that the Dysport gives you the best value for the money. It lasts the longest for the cost. So you can use any of these products, but what I'm going to do today is show you the most common ways to inject the toxins to get perfect results every time and to avoid the common complications that you have. So the first thing we want to do is to show you how to inject the glabella. So these are the number 11 lines here, and you also have these horizontal lines and the bunny lines that could occur. These lines are created by a series of muscles right in this area here, and the muscles that we're talking about are the procerus, which is right in the middle here, and the corrugator muscles that kind of split in two directions here. And what we're going to do is we're going to inject these with botulinum toxin, and the direction that we're injecting matters. So what I like to do is start with the procerus here, and I kind of point upwards towards the forehead, going at a 45-degree angle, and you can even pinch that muscle between your finger and inject into the muscle. You don't want to go all the way down to the bone. You want to hit the meat of the muscle. So when I drew these arrows, the back of the arrow is my entry point, and the head of the arrow here is where the tip of the needle is going to be, and that's where we're delivering the product. Okay, so when you go in at this angle from the bottom, you can hit the middle of that procerus muscle. And same thing for the corrugator, the medial part of the corrugator. I like to go in just above the medial part of the brow, and this is my entry point at the tail of this arrow, and I'm going to aim it 45-degree towards the meaty part of this muscle right here. And then we want to hit that tail of the corrugator as well, and I go in actually through the brow, and I'm going to inject and here. And you want to be careful not to go too deep because the frontalis muscle is behind that corrugator. If you go too deep, you're going to hit this part of the frontalis, which could cause a droop. Okay, so typically the amount that I'm injecting here, the blue is where I'm going to do a full increment using the 0.3 cc insulin syringe. So if I reconstitute the Botox or the Dysport, and I do it the same for both products, even though it's slightly different concentration, I'll put 2 cc's into a 100-unit vial of Botox or 2 cc into a 300-unit vial of Dysport. And if I do that, then one increment on that insulin syringe is going to be equal to 7.5 units of Dysport or 2.5 units of Botox. So this is where I do a full increment. And then these areas here, like the tail of the corrugator, or if I'm injecting the nasalis muscle here for the lines, I'm going to do half an increment, which is about 1.25 units of Botox or 3.75 units of Dysport. So the white's going to represent 3. Just something to keep in mind if you're injecting these bunny lines, the transverse nasalis muscle here is the target. You're going to go in laterally and then point medially, because if you go too lateral and hit the levator labii superioris, labii means lip, and if you hit that, it's going to cause the lip to droop. So these are the injection points. So now let's go to the forehead, and that's these horizontal lines up here. The forehead muscles are going to hold your brow up. Okay, so you have to be careful not to do too much on the forehead, or it's going to cause the brow to droop down. So How do we inject the forehead? First, we want to look at the lines. Okay, so these are going to vary on the forehead. Most people are going to have like these archy lines where the peak is kind of towards the side, but some people will have these lines going straight across. And then you also have these lines at the corner of the brow here. Some people will call these the Wi-Fi lines. Now let's take a look at how these lines are formed. And if you look at the muscle here, you see that the frontalis muscle is going to be divided up. So in this patient here, the muscle splits in the middle over here and clumps up towards on each side of the forehead. And the bulk of the muscle is going to be right here, usually about the pupillary line. And you can see that's where it arches. That's where the lines arch because that's the strongest and bulkiest part of the muscle. Okay, so and it thins out as it goes laterally and also when it goes medially. So this is where you're going to hit the biggest dose right in the meaty part of the forehead. And then this area here close to the brow, you have to be careful because I will show you what happens if you inject incorrectly in this lateral brow here. Okay, so remember how that looks. And now let's take a look at how we're going to inject. Okay, so the blue line is where we're going to inject the full increment, and that's going to be 7.5 units of Dysport or 2.5 units of Botox. And I only do a full increment right in the middle here where it's the bulkiest. And the other areas I'm going to do half increments, which is 1.25 units of Botox or 3.75 units of Dysport. So I'm going to inject first full increments. And remember I'm going in where if you look at the arrow, the tail of the arrow is where I'm going in, and the arrow head is where the needle tip is going to end up. So the direction that you inject is going to matter because if you inject this way from this side and then this way from this side, it's going to be uneven. So you're going to go medial to lateral for these, and for when you're coming on, when you're hitting the muscle here towards the scalp line, what you're going to do is go in superiorly and then point down towards the muscle. And you want to always point towards the medius part of the muscle because when you inject, that's the direction that the product is going to squirt into the muscle. Now, here, the sides here, yeah, you have to be careful of injecting. Some people won't even inject here because they're afraid to cause a ptosis, okay? And it's not really this muscle that's causing the ptosis. Let's take a look at what's happening. But if you inject from the brow and go in upwards and inject upwards above the brow, then that should be safe as long as you don't go too deep. Stay superficial. Okay, now let's take a look at the crow's feet. Okay, of course, the crow's feet are these lines around the eyes, the orbicularis oculi. Okay, and we'll show you how to inject that. But before we go to that, let's look at what happens when you get a ptosis. So how does this occur? You can inject pretty much the same way, same patient forever, and then one day they get a ptosis and you injected the same amount. So why would that happen if you injected the same way all the time? Why doesn't it happen all the time? Why did it happen? So let's take a look at what's causing it. Okay, so the muscle that actually causes the ptosis is behind the orbit, and that's the levator palpebrae superioris, and it is behind the orbit. And you're injecting here, okay, when you're injecting the brow and the forehead. So you're not hitting this muscle most of the times when you're doing the injections, but if you have the needle pointing this way downwards towards this little foramen here, okay, this is what's going to cause the ptosis. If you get the product into this hole, it will go follow the nerve into the skull, through the skull, and hit this muscle. And that's what causes the ptosis. So that's why you can be injecting in this area constantly and never have a problem until one day you get too close to that foramen and then you get that ptosis. Okay, so how do we avoid that? All right. So if you have the foramen here, and it's a tiny foramen, so you can't. Sometimes you can feel it, but usually you can't. Unlike the ocular foramen over here, that one, this one you can usually feel, and same as the infraorbital foramen here, you can feel those. But this one, it's hard to find. So you have to kind of know where it usually is and stay away from it. So notice how, remember I said you go in at the tail of this arrow and the needle's going to end up at the head of the arrow here. So if you go in this way, point upward and inject, you're not going to be squirting into this foramen because you're going towards the forehead now. And same thing when you're injecting the crow's feet. I like to inject downward. I can go in close to the foramen, but I want to end up with the tip of the needle away from that foramen. So when it injects, it's going to come out, not into that foramen. And then for these parts of the crow's feet, again, I like to go in closer to the eye and inject outward, not the other way around. You don't want to inject out to in. You want to inject in to out. Okay, so that when you inject, it squirts into the bulkiest part of the muscle, and that's how we can get replicatable results every single time and not have to worry about complications like ptosis. And the other areas that you don't want to really inject toxins is here under the eye, because that can cause the lower eye to kind of droop. So if you do, sometimes you have a little jelly roll here and you want to inject, if you're going to inject that jelly roll, very, very minuscule amount, and you're going to inject into this muscle here. But I would rather just avoid that because because their skin is lax, they're going to have trouble closing the eye.